Home health aides. Home health aides combine the duties of health workers and social service workers. For many people who are confined to their home due to illness or injury, a visit from their health aide is a bright spot in their day. These healthcare workers help elderly, disabled, and sick people to live in their own homes instead of in a health facility.
Sometimes we do laundry, sometimes we do a little bit of cleaning house, getting breakfast and dinner, and we get people up and put them to bed.
They may help patients who have been discharged from the hospital and therefore have relatively short-term needs. Some patients may need help in moving from their bed, bathing, dressing, and grooming.
Help them with their what they call ADLs, which is activities of daily living. You help the people do the things that they can no longer do for themselves. You either do it for them or you help them keep that level of independence. Help them keep their self-esteem.
Home health aides receive training that teaches them how to perform certain medical tasks, such as checking the person's pulse and respiration, taking their temperature, and helping them set up routines for taking their medications or doing prescribed exercises. They may also change non-sterile dressings, give massages, or assist with braces or artificial limbs.
I just think it's a very rewarding career, and I really like being with these people who are needy and helping them get through each day and living in their own home.
Some may take their clients outside their home, serving as a guide, companion, and aide. Homemaker home health aides sometimes provide housekeeping services such as cleaning, doing laundry, cooking, or grocery shopping. Following each visit, the aide records the services that were performed and describes the client's condition and progress.
With the home health care, you're able to keep somebody home as long as possible. And they're much happier around their own things. They can keep their animals, they're around their pictures and their memories and stuff like that.
I like the most about my work is getting to meet these older people that have wonderful stories to tell about their life and their situation and how they got where they are now and how they are struggling to maintain as much of a quality of life as they can living with the disability that they have.
Many aides have a varied routine, working part-time and on weekends. They usually work for home health agencies, visiting nurse associations, hospices, hospitals, or public health and welfare departments. Generally, they work on their own, with periodic visits by a supervisor. Their supervisor gives them detailed instructions explaining when to visit the clients and what services to perform.
It's really an ongoing process. The medical field, you never know everything. So it's kind of fun that way. You never get tired of the job. It changes every day.
Home health aide is one of the fastest growing occupations, with jobs more than doubling over the next 10 years. This is primarily because of the growing elderly population and the efforts to contain healthcare costs by moving patients out of the hospitals quickly. Turnover in this occupation is high, primarily because of the relatively low skill requirements, low pay, and high emotional demands of this type of work. The typical job duties include going grocery shopping and cooking for their patients, helping patients bathe, dress, and comb their hair, changing patients' bandages or non-sterile dressings, and taking patients on short trips outside their home. The earnings range is from $5 to $8 per hour. Most employers hire only on-call hourly workers and provide no benefits. However, some are paid on a salary or per-visit basis. Employers who receive Medicare reimbursement have the following guidelines: 75 hours of classroom and practical training supervised by a registered nurse, and passing a competency test covering 12 specific areas. Certification is available. In some states, no formal training is necessary. The employment outlook is excellent. Job opportunities will be particularly good for those with experience or training as home health aides or nurses' aides. For additional information, you can write the Foundation for Hospice and Home Care, National Certification Programs, 519 C Street, Northeast, Washington, D.C., 20002.